Welcome to Trulyfit.
Jenny, thanks so much for joining the Trulyfit Podcast. Why don't you give my listeners and the audience a little background on who you are and what it is that you do in the health world?
Yes. Well, thank you so much for having me today. So I own a company aimed at helping families thrive. We think every family needs a tribe. And so my background as a PT, we bring in and incorporate into the wellness realm, specifically for kids and young families and working with moms who are getting back to being themselves postpartum.
Cool. And give me some more insights into your PT background. I know sometimes PTs eventually kind of like sub-specialize into certain things. And do you have some of those?
Yeah, absolutely. So I spent 10 years really working in the corporate medical field, specializing in neuro and peds, and those two together in particular. So a lot with head trauma and head trauma rehabilitation. And that's probably what really prompted me to get more into the wellness piece of it, appreciating how important that was for my own life. I started to expand on that with my patients and really have now come full circle into a more holistic approach of addressing all the things that are affecting a child, not just their physical impairments.
And I assume that's because there is a lot of, and I don't mean this to be a leading question, so you can tell me a lot of red tape in the PT world. So maybe a child came in who had a particular issue that you thought you could help maybe outside of the scope of just giving the neuro information, but you're not allowed to?
Yeah, definitely. Right. So as a PT, particularly when we're using insurance, right, because we have the training to use all that other knowledge and experience. But in the insurance model, they just want you to treat the impairment and specifically what is worse, right? So we aren't necessarily even supposed to make them better, which is just beyond crazy to me. So being able to bridge that gap from not just improving to the level of back where they were, but let's get them to the best that they can be. And so using that model outside of insurance and outside of the medical scope to be able to do that.
Yeah, no, that's a problem, I would say, in the whole sort of healthcare system, not always having the ability to look, like the term, sometimes is look down upon, but holistically at the full body. But we know that we need to more often than not look at those things. Were there any other issues that you felt that you encountered in your sort of more corporate world that you were like, hey, I need to get out of here and start my own gig?
Yeah. Oh gosh. I mean, so I have a lot of love for the agency I came from, but yeah, I mean, it's the limitations of the medical model, right? And so we're so siloed in terms of who we are as professionals. I didn't have a lot of carryover and communication with the physicians like I would like to be able to be more holistic. I didn't have a nice continuum of care of places to send them once they were done with their rehab goals or to continue learning and developing as, children. And so that was really kind of the crux of getting out was I want to do this better than I can do it under the medical umbrella.
So I have listened and read some things that you have wrote about and talked about, and I think that milestones are very interesting. I have an 18-month-old, and there's a lot of parents that listen to this podcast, and milestones can be quite confusing because you as a parent will naturally probably tell yourself, my kid will eventually get there. You hope the kid will get there. The milestones are set in these, let's say, these parameters for that are specific to time. Let's say, okay, between 12 months and 14 months, your child should be doing X, Y, and Z. What do you think about milestones as a whole? Are parents either too hypersensitive to this? Are we paying too much attention? Maybe not enough attention? How do you talk through the process of milestone with young parents?
Yeah, man, I could get on a soapbox about this, but let me give you a little bit of perspective. So a few months ago, the CDC updated their milestones and they moved them back based on when most children should be doing skills. So now the trickle-down effect of that is the pediatrician or whoever you're seeing that's kind of checking in on those things, or even as you're reading yourself, isn't going to necessarily flag something as concerning until much later. So on one hand, that could be good because there are times where parents, I think, are overly cautious, right? But on the other hand, if there are truly issues, sometimes that wait and see approach is detrimental because there's so many things that happen in development that are relevant to the skills before that, right? So for example, children we know who don't move as early develop slower cognitively. So if you wait and see and your child's not walking or not exploring their environment, they're not learning what happens when I open this door and close it, which is a big part of child cognitive development. So I really prefer more of a let's check it out and see, right? If you have a question, you have a concern, and that's kind of where we've gone from a wellness perspective. If it doesn't need to be PT, but the worst thing is I check it out and say, hey, your child's doing really well, but here are 3 things you could do to continue them on that process of developing these skills to keep them up to date on everything else we want them to learn.
Why do you think that parents are less likely to do this? And I'll give you two potential reasons. And if these are
Yeah.
neither of them, you can just respond on your own. But one is, just the process of, okay, I have to first go to my pediatrician, and then they have to give me a referral. And then I have to hope that referral process goes smoothly between the pediatric office and the PT. Does the PT call me in time? They're going to say, hey, we can see you in 6 weeks. Well, in 6 weeks, my child's going to be past that milestone anyway, right? Or is it because parents are just, they want to be glass half full and say, my child will do it eventually?
Yeah, so I think those are both really good reasons. And then a third one that I oftentimes just hear realistically from parents is I'm busy, right? Like it isn't on my radar, or it is on my radar, but I also have these 17 other things I have to do first as a busy working parent, and getting off of work early to go to another appointment to get my child there where they may or may not do something because it's a new environment and they don't know these people. It doesn't necessarily bubble up to the top, right? And so that is also part of what we've done, is take the challenge out of that for families and say, we come to you. This is wellness based. So depending on your state, a lot of states don't require that pediatrician visit to come in and say, let's just check it out. It's direct to us. We can come directly to you. There's no wait. It might be next week, but it's not 6 weeks. And we can be in your home environment if that's where your child's going to be most comfortable, because realistically, that's where you're going to work on the skills. And so from a parenting perspective, it just makes sense to me to give you the tools that you already have to make that better for your child.
Yeah, and that might be something scary too. Just thinking about using the terms PT, you think more clinical. I'm going into this office. There's going to be a bunch of these crazy machines here. They're going to be strapping my legs in, looking at certain meters. But it's like, no, this is a child. This is more about like the normal play routine, but you're just looking because you understand the body and how things should be working. You're just looking at the little things. Okay, their gait is messed up. Here's how we help their gait a little bit. Make sure you do X, Y, and Z. And it's really just tips for the parents so they can do these things on their own. Is that correct?
Yeah, absolutely. And using what you already have, right? Because that's what's going to be most familiar to the child. And, you guys know too, it's not what you do just in that time together, but what the client does in that time outside of your time together. So giving them the tools to be successful, just like you would from a training perspective.
Is there room in either what you do now or in the PT world to give parents advice if you believe that let's say their physical limitations are due to the parenting style? So for example, if the mom is always picking the child up and not actually letting the child go around and run and do those sorts of things, do you feel like you have that leverage to speak into that?
Yeah, that's a great question. I mean, as a PT, we certainly do. I think it's all about rating your families though, right? Because if you came to me for advice and I'm like, stop picking your child up, that might not be what you want to hear, right? So let's start from, hey, what does your routine look like? Why do you do that? I've had a family say to me, I have 6 other kids. They have to be up off the floor because they're going to get run over. Okay, well, let's figure out how we can solve that, how we can create space for them to work in without saying, stop picking your child up, right? So I think that's one realm that we definitely have worked to improve in. It's just how do we provide that? How do we get them to realize themselves oftentimes, hey, this is probably something I need to do, as opposed to being told that. I think we're all better at that when we have an internal motivation. And then I think the other thing is our play groups, and something, I think we're going to talk about in a little bit, but that's one of the reasons we started those, is to create that environment where other parents are saying things, right? It doesn't have to come from the clinician who, for me, I happen to be a parent of a young child as well, but some of my clinicians, either their kids are grown or they don't have children yet. And so it's easy to look at them and be like, easy for you to say, you have no idea, right? So when you have another parent saying it and they've been through it and they have their own experience, I think that lends itself well to credibility too.
Yeah, and I love how you kind of hinted on that client relations part of it, or patient relations, that strategic two-way communication between you and the patient, trying to really read them and say, okay, this is what I want to say, but they don't want to hear this right now. So I have to reframe this and rephrase this in a way where it's going to be advantageous to the parent. Maybe I have to bring them along a little bit slower than I would another family, and analyzing that. And that takes time to develop in your career. It's us as personal trainers. Some people struggle with that too. They understand the body well. They can write a program out well, but they don't quite see the nuances and maybe like the mannerisms of the client to say, well, maybe this client's not ready for this and I have to adjust.
Absolutely. And I think, that comes back for a child, not only to how's the child functioning, but how's the family functioning, right? When I've got a family who is constantly living in chaos, it's going to be really hard to expect them to do XYZ with their child, right? So how do I then set the environment up so that child can do it on their own, as opposed to putting one more thing on an overwhelmed parent? Let's maybe spend some time talking about what can we take off your plate, or how do you prioritize these things so that you can get the things you need for your child can be successful, and you can feel successful as a parent as well.
Would a possible way that someone would go about wait and see is, let's go ahead and say the milestone is supposed to be between 12 and 14 months. Okay, whatever this milestone is, whatever this activity is the child's supposed to be doing. Maybe they're supposed to be recognizing their feet and starting to kick and use their feet for more things. And you're like, well, my child's not really doing that. Wouldn't it be smart of me to just book the appointment? And even if it is 2 months out or 3 months out, just to have it there as sort of a backup, a safety net in case my child does get to that 15-month mark and they're not doing it?
Yeah, absolutely. I think part of the challenge with that is oftentimes if you're going through your pediatrician, who might be your primary source for that information, they'll say, oh, we'll check it again at the 15-month checkup. So they're waiting until it is delayed before they say, oh yeah, you should go see somebody oftentimes. And that's the way the milestones are set up. That's the way they're instructed, but it doesn't always mean that that's going to be the best for the child in that situation. So I think that check and see, or put it on the calendar and see, is a way better approach, but it isn't always the one that our direct primary care does. And it's not necessarily in line with what the milestones currently suggest.
And I think you referenced before, it is state by state as far as if I have to go directly to the pediatrician as opposed to calling the PT office and just setting an appointment. And then also a lot of PTs, correct me if I'm wrong, you don't necessarily even need to use your insurance. You can just pay out of pocket if you think it's that serious and you have the money.
Yeah, absolutely. So I think a lot of that comes down to the medical model that most people are used to, right? So if you go to a big health center, they're probably going to require, just by standard, you to have an order on file, to have seen your pediatrician. And we think those are good things, right? You want those relationships. But in most states, there is some form, in all but just a couple of states, there's some form of direct access, meaning you can see a PT or an OT or speech without having to have that order and recommendation from your physician. So, your physician is the expert in your child's overall development. But if you want to know about their walking or their talking or their ability to feed themselves, that's where your rehab team comes in. And there's so much benefit to seeing somebody who's truly an expert in that area if you have questions and worries, even just to put you at ease about what else might be going on or what else you could try to be successful and feel confident as a parent.
I had a fellow parent and friend tell me, and I wonder what your thoughts are on this. If you give your child something to do, let's say like use a fork, and they can do it right away, you screwed up. Because you should have given them that task before they were able to do that so that they actually had to work on it. It's not that it's too late. It's just that it would have been better if they developed that rather than already know how to do it. Do you sort of agree with that or not necessarily?
Yeah, I think that's an interesting perspective and an interesting way to think about it that I hadn't before, but I agree, right? I think so many times we're so cautious and so quick to say, ooh, be careful, or ooh, not yet, where kids learn by doing, right? They don't have necessarily that cognitive thought process to think about things abstractly. So giving them the fork, putting it in their hand and letting them try and stab something with it and miss and try again is a great tool for learning. It doesn't mean that's how they're going to feed themselves, right? I might give that child a fork and also have a fork in my hand so that I can actually get the food in their mouth. But giving them that practice is an awesome opportunity because that is how they're going to learn, is by doing.
Talk about the functional play groups, how you describe it personally and how you use it in your practice, and then how maybe just play groups in general are advantageous for children.
Yeah, so we developed play groups purely to, obviously play with the child, right? But with the underlying goal of bringing together families to create confident and connected families. I feel like too often either, parents are busy working or they're rushing around to do their to-do list and they miss that opportunity to connect with their child, which doesn't need to be complicated, right? It doesn't have to be 3 hours of this really creative play. It can be 10 minutes sitting on the floor doing whatever they're doing with them. And it builds that relationship with the child. I think too many parents don't have that. And, you go to the internet and you search and you find 4 million different reasons about why you're screwing your child up. And so I think we just want to bring back that opportunity to feel confident as a parent, to know that you know what you're doing, give you some simple tricks to make parenting easier because we're all busy and it's always hard. And so we have developmental led play groups by our experts, right? So whether it's me or our developmental specialist or a couple of teachers that run them, you're bringing somebody in who knows development, who understands and can help you connect with your child and understand what your child needs. That isn't this complicated thing. I think playgroups in general are great because it again just brings parents together, so they get to ask questions, they get to hear what somebody else did who's maybe a little farther along in that journey or went through that a couple months ago. And so it's always nice to have other resources. We just feel that that expert bringing in that perspective of maybe why this is a better way to try than this for you is also helpful.
Are there recommendations, and this may be like based upon age, right? Maybe a 3-year-old's different than a 7-year-old, but how many kids is best to be playing at one time? Does it make a difference if it's just routinely 2 children as opposed to 12?
Yeah, good question. So some of that depends on the child's age. You're definitely right, because kids develop play at certain ages. So for example, at a year, I don't expect them to interact with a peer. I expect them to play next to them and maybe not even care that they're there. But by 18 months, maybe at least paying attention to what they're doing. By 2, starting to socially interact and look for those pieces of interaction back, right? So all of that matters in terms of who else is present. And so you could have 50 kids, that 1-year-old isn't going to care. But then beyond that, a lot of it really is in the educational research when you look at classroom size and things like that. And we know that there's a ton of association between a smaller group size in the classroom, let's say under 15, and better behavior, better learning outcomes, and all of those kinds of things. And that's not to say that your kid can't excel in a busier classroom, but there is some research behind that. So we kind of take that into account as well, because what we appreciate from the playgroup is that children learn by watching others, right? So good and bad. If I want to figure out how to get up on that play structure and that other kid just did it, and I watched them do it, and I watched this other kid do it in a different way, I have now started to build that motor pattern of how I'm going to do it as well. And so that's super important. The social skills are super important. And I think, if you get the child in a group too large, they kind of get lost in that. It's hard to focus on what the instructor is doing, what the other kids are doing, and to give them that time and opportunity. So I think it's a balance, but I don't know that there's an actual number.
Yeah, and that's what I thought the answer was going to be, and I think that's it's interesting. The first thing that was going through my head is there's so many. We have there's 2 different parks that I have right down the street from me, and they're literally across the street from each other. And I will tend to take my child to the park where there's no kids. Yeah. And now that I'm thinking about it, I just say, well, no, of course, now she has more opportunity to play with those on those slides and climb up those stairs, but. It's actually probably better that I bring her to the park where there are 2 or 3 kids so that she can watch those kids and how they develop, because that's how she's learning. And I really never thought of it that way.
Sure. And now she has the opportunity to learn how to wait her turn and not, run over the kid that's on the slide and those kinds of things, which are important as they get closer to 2 as well.
So tell me a little bit more about your day-to-day now. So you transitioned away from the corporate lifestyle, partly because we talked about before, is a little bit more red tape. So you still work in a PT fashion with children, but you also do a little bit more of a holistic approach in a almost interwoven with personal trainers and CrossFit. Talk about that.
Yeah, absolutely. So I really, like I said, focus on families, but in a lot of our families, we talk about moms and pregnancy and postpartum and holistic health for that. And so in that context, and that isn't my sole audience, but I also then work at a CrossFit style gym where I've got a lot of great trainers. I mean, I've been a member there for 5 years myself, but what I love about that environment is you've got a mom who isn't able to lose the weight, feels like she doesn't have enough energy to work out. She's not getting the gains that we would expect based on the programming she's doing. So I might see her for a session or 2 to say, okay, what is going on with her overall health? Let's look at gut health, hormones, all of those things that are so impactful, in addition to all the lifestyle things that, the trainers have already incorporated, to get to the bottom of what's going on. So that information, I certainly do that with the CrossFit style athlete. I do that with my postpartum moms, and I do that with the kids too. So when I've got kids on the caseload who aren't developing at the rate we'd expect, I mean, one of the populations I see a lot is kids who are delayed walkers, and they almost always are constipated, right? So being able to carry that over, and let's talk about what's going on with their gut health that might be impacting their ability to motor plan, to gain that strength to learn. And I think people forget, right? And as adults, we understand how interconnected those things are, but for kids, we forget that oftentimes, that all those things are also impacting their development. And so being able to step outside of just my PT hat and wear that functional wellness hat and incorporate that for all of our clients in our clinic. We have a team of 14 providers right now. And so, they will refer back to me when they've got somebody who maybe has more functional needs, and then I'll refer back to them when they need more therapy.
That's fantastic. And as personal trainers, ideally, we would like to handle a little bit of everything. If we knew, even like some personal trainers don't have that skill set, but even if you do, really what the client hour is, what they're paying for is for you to develop a program for them to obviously focus on their long-term health, but really a lot of short-term health goals, whatever those goals are. Maybe they want to lose a few pounds, or they want to have the bigger biceps, or whatever they're trying to do. But it's really difficult as a personal trainer because you're only getting paid by the hour in most cases. That's how this works, is to handle all of those other things outside of it. So it's great to have other people to say, hey, listen, we're doing everything here, right? We're looking at sort of the big picture. You're working out 5 days a week, and your sleep seems to be okay. Your water intake is okay. We are in a caloric deficit, yet you're not reaching these weight loss goals. So it has to be something else. Let's ship you off to someone else who knows a little bit more about these other areas to just, if nothing else, check these boxes off to make sure that it isn't something more serious. Do you have a hormonal imbalance issue? Do you have something going on, under the curtain that we just didn't recognize? Because otherwise you're fighting an uphill battle as a personal trainer and the client, and you're doing them a disservice because they're paying and they're never going to get to their goals.
Yeah. Well, and I think for my trainers too, it makes them look good, right? Like when we get to the bottom of that and the client starts moving forward on their goals, that makes them feel good, right? And also elevates them in the eyes of the client because they were able to come to that success point, which is all they really care about. I don't care how I get there. Help me get there.
Yeah, and it's just another networking branch off the tree, right? So just the same thing as if my client was having severe knee pain, eventually, right, we need some sort of diagnosis, and you only get that diagnosis, it's above our pay grade. There needs to be imaging, then they need to be sent to the PT, right? So this is no different. If they're having weight loss issues, I think a lot of personal trainers find it almost like it's a slap in the face if they were to send them somewhere else. It's like, no, this is what I do. I help people lose weight, help people get in shape, but they have to understand that there's sort of a cap in our ability and our understanding. And eventually you have to have that networking community and not take it as an ego hit, but just know that if the goal is to help the client, I'm going to have to refer them up the ladder to someone who knows more.
Yeah, absolutely. Well, and and where I got into that in the first place was appreciating for my kids who were eating chicken nuggets and cheese every day, right? And weren't having good bowel movements and weren't moving and weren't doing all these things. When I look up the chain of what's happening in the family, the reality is mom sets the tone, right? She's usually the one that does the grocery shopping. I mean, I know there are differences, but I would say majority of the families, that's how it works. And so, if I can help her understand the importance of all of those factors in health, then it affects her own health, but it also affects the health of her family. So
give me a little bit more information concerning I'm going to go back to what we started with the milestones. So I have a few more questions there. So if a parent runs into a problem in which they believe it's a structural problem, right? They're like, oh, my child's not walking. I think there's something wrong with their hip. Do you think that's misguided for them to sort of self-diagnose? Because it could be a host of other things, but is the first step still going to your general pediatric doctor, or do you send them? Do you go straight to the PT? Well, what is the first step in that process?
Yeah, that's awesome. That's a great question. First of all, I think parents are always the experts in their child. So when they come to me and they say, "Oh, well, you're the expert," well, I might be, but really, you're the expert in your child. You're the one that's with them 24/7, and so if you think you've done your research, you just have this gut feeling there's something going on, and you need to see somebody, right? And if your pediatrician doesn't seem receptive to that, then see somebody else, if nothing else, for peace of mind and to help you understand why you're seeing what you're seeing. So I see a lot of kids who will come in and say, hey, my child's not walking. They're 15 months. I know the new milestone is 18 months, but it just seems like they're not even close. And we'll start down that path of why. Is there something structurally? Certainly I'll refer them back to the physician or to orthopedics or something like that. But sometimes it's as simple as creating a plan for them to get more opportunities to practice those skills that are pre-walking, right? As non-pediatric PTs, you're like, well, they crawl and then they walk, right? But there's a lot that happens in between there of, gaining balance, being able to stand on one foot, shifting their weight, being able to not fall over, standing up from the floor, all those things that I don't expect a parent to know. That's my job. And so if you're looking at them thinking something's not right, I think that's a great opportunity to come in and see somebody and just get a second opinion.
What about exercising with your children? What are your thoughts on that? Just from a, it doesn't even need to be from a clinical standpoint, but just from
Yeah.
like a family standpoint, is there an age in which you believe it could be, let's say, deleterious from a mindset perspective? I don't want my kid to worry about exercise and body type and body image. Or do you think like, no, this should be a good thing. It's a shared experience between mother and daughter or father and son or vice versa?
Yeah, that's an awesome question. And I think, blending what I do from a functional perspective with what I do as a PT, I don't think it's ever too young to be active with your kids, right? And active lifestyles, we live in a place where we sit 90% of the day as adults, and that's such a problem. We also don't play enough as adults, right? So I think getting outside and being active with your kids, exercise doesn't have to look like, let's get on the bench press and do 3 sets of 10. It can be, let's play this tag game in the backyard where we're falling to the ground and pushing ourselves back up. I mean, that's burpees and running, right? But it's not in that context. And so I think there's never an age that's too young. Most kids love to be outside, love to run. The worst thing I always hear when I hear families say, like, I'll ask, how do you play with your child? Oh, well, they like to sit in my lap and look at my phone. It's like, oh, that's the last thing they need, right? And I've heard that more than once. So I think, I always encourage families to be silly, be creative, be active together. Yeah, there is certainly an age where, too much training can be a problem for skeletal development and things like that. But generally speaking, unless I'm talking about the athlete population, I don't see that. It's usually under exercise, under activity. And so getting out and being active is always a good thing.
Are there either short-term or long-term things that you point out to parents that they should be looking into, or at least have an understanding of if their kids are in daycare as opposed to not in daycare? And my first thought was, well, if they're in daycare, they're seeing kids more. They have maybe other people around them who see kids all day. So there's like there's more responses to what's going on with your child, as opposed to if your child's home and it's your first child, maybe you're not as in tune to what's going on.
Yeah, I mean, I think that's so parent specific, right? Some parents are super worried because they're in daycare and are they not getting enough individualized attention? And should I be doing more? And I've got to do all these things outside of daycare with them, which isn't always reality either. But then I see the other side of it where, I'm at home, they're my first child. They're perfect because they're my child, right? And so I don't want anything to be wrong. And so I think a lot of that is really parent specific. And again, coming back to really getting to know our clients and understand what their fears are, what their understanding is, where the limitations are, and starting with what they came to see us for. So I might see all these things, right? You guys do this too, but really they came in for this and they don't care how much I know about all of this until I've answered this for them. So I think it's building that relationship, building that trust, and then starting to have those conversations of just other things to think about. As a parent, one of the things I look at every school I look at for my son is how much physical activity do they get? And I think those are things that we don't necessarily think to ask at daycares and, maybe not even when they get to school, but we know from a cognitive development standpoint and a physical development standpoint, all of that movement is so important for them. So I want to make sure that my kids that I'm working with are thinking about that as well.
Let's close here back to adults, and I'll throw out a scenario for you, and you can tell me if this is something along the lines of what you would deal with and how you would deal with it. So somebody is struggling to lose weight. Let's say it's an older mom. I don't like to use the term older. I shouldn't say that. A mom in her let's say early 40s, and she is struggling to lose weight. She goes to your CrossFit gym. She comes to you, and the personal trainer has told you they're in a caloric deficit. They've been lifting. She is otherwise healthy lifestyle. She doesn't drink. She sleeps well. Her water intake is good. All these things. She's not on a lot of medications. And you say, let's look at the hormones. Are you actually sending her to the physician to get hormone panels done and then analyzing them yourself? How does that process go?
Yeah, that's a great question. So I guess some of it depends, right? But I actually usually run functional labs. I find that most of the serum labs that are done by the physicians give you a snapshot of one point in time, and our hormones fluctuate throughout the day. So there's so many things that a typical lab panel doesn't tell us, and usually they come to me with that, right? And their labs are fine. They've been to their physician. Everything's fine, but they're not losing weight. And so we'll start to look at functional labs and look at what is actually going on with their cortisol. Is their cortisol stealing from their sex hormones? Usually along with that is low libido, like not wanting to be intimate, which is a problem in their marriage, right? So there's so many deeper things that we get into than just also this weight that I can't lose. But we look at those labs and I send off for those and interpret those, and then we make a plan. Sometimes it's as simple as tweaking a couple of supplements, or it's black and white picture of you might be trying to control your stress, but it turns out you're not doing a good job. Here are some ways we could work on that better. And, let's continue to focus there. And so I think those pieces are so important to that overall picture, especially when somebody is stuck or they've tried all the other things and it's just not helping. And yeah, we do that and take all of that into account as well.
So if you were to describe, or if you had, let's say, two columns and you had functional labs at the top of this column and you would have traditional labs at the top of this column, can you explain sort of the differences and how you would describe those two?
Yeah, so functional labs are things like you'll hear people say a GI map or a CSAP, but basically those are stool tests, right? Looking at the composition of the stool to figure out what's going on back in the gut. What's that microbiome like? Are there any parasites in there? Is their pH right? All of those things that you don't get from serum testing. Hormones, similarly, right? So we're looking at urine output and saliva output. What are the metabolites of your hormones? And again, if you look at your traditional lab tests, which might give you, thyroid panels and hormone panels and things like that, you're getting that one snapshot in time, whereas we're looking at how much estrogen are you making? How quickly are you breaking it down? Are you getting rid of it fast enough? Because that might be another reason you're keeping the weight on. So we can look at not only are you making enough, do you have a high enough level, but what's happening to it? Because if we dump more in and you're making enough, then you're just breaking it down faster and we haven't fixed anything. Whereas maybe we need to slow down how quickly you break it down or push things back, over this way when they're over on this side. So that's what we look at a little bit more from a functional standpoint. And again, this is a lot of times my clients who have come in and said, my labs are all normal. I've been to the doctor. Or my hormones are off and they want to put me on synthetic hormones, which can wreak havoc in health down the line, as you guys know. So let's try everything else first, if that's their motivation, to see what we can get to help them.
When these functional labs, let's say, return to you, is this something that a layman could analyze and read? Could I see this paperwork and have an idea of what's going on? Like in traditional labs, you have ranges, so anybody can look at it and be like, "Oh, I fell within the range. This is, it's not below this number, so I'm fine." Or is this sort of like really more intricate things that you have to study and be able to analyze and interpret?
Yeah, that's a great question. I mean, certainly if somebody's flatlined out, you can look at that and go, you have no cortisol, right? But a lot of times it's in the context of everything else. And so even though this might look fine, it's based on the range compared to this and the symptom you're describing. So no, I went through pretty extensive training to do that. And I would say most physicians don't even have that concept and necessarily use that because they don't understand it. So I think it's a pretty specialized, unique tool to be able to support my clients as they're going through those health journeys.
Yeah, that's a great answer. And I think there's not enough of that. I hope it happens more. And I get why there's not in the industry. People are specialists because that's what they study. They study the one thing. But if you're a hammer, everything's a nail, and you're only looking at it from one perspective, right?
Right.
If you go into the surgeon, he's going to tell you he's going to fix it with surgery. You go into the PT, they're going to fix it through physical therapy. You go into the doctor who prescribes medicine, he's going to fix it with his medication. And it is good to really step back and say, well, if there's 3 different ways I can fix this, that doesn't make sense.
Yeah.
I have to really analyze what's going on here and maybe take a more holistic approach. I wish there was another word for that, because what happens is when people hear the word holistic, they associate it with like somebody who lives out in the woods and is trying to pick leaves off of the plant and eat them for, and it's like, no, that's not really what it's about. It's about understanding that everything in our health is interconnected. Physiologically speaking, psychologically speaking, it's all interconnected. And if we're only looking at one area, we're missing the bigger picture.
Absolutely. And I think, I'm a great picture of that, right? I went into the specialty of neuro and peds and got so specific as a pediatric neurologic physical therapist, right? And then quickly realized there is so much more outside of me that is impacting this client. And that's part of how I got to where I am today, right? So I just said to somebody this morning, right? If all you have is a hammer, everything's a nail. If all you have is this specific training and this tool, even in rehab, you're this kind of therapist, that's all you're going to use. If you're this kind of surgeon, that's all you're going to do. The orthotist is always going to brace. And so I think having somebody who can step back and look at evidence-based medicine as being what it is, right? We forget that a big portion of that is the patient. And so, I have a client right now who came to me and said, I went to the doctor and they just told me I need to be on medication for this, and I don't want that, and I don't know who else to see. And it's such a sad situation that that's where we've come to. But I think people have to realize too that some of that is driven by the insurance model, the medical model, right? The payers are what drives that. And so if you want something better, you're going to have to go outside of that system that forces us into this funnel of medication for this, surgery for that, specific treatment for this, and look for somebody who has a more, you're right, holistic has a bad rap to it, but holistic approach to understanding how all of those pieces integrate to affect your health and how we can fix it.
Well, having people like you really helps us. Again, I said this before in our industry, because sometimes it seems, and it is above our pay grade to tell our clients these sorts of things, right? Oh, hey, the reason why you're not meeting your goals, you're on 8 different medications. And I don't know synergistically how those things are even interacting, not only in your body, but with each other to slow down our goals, right? You're on this cholesterol medication. Have you ever went to the doctor and said, well, what's happening to my cholesterol? What do you okay, how is this cholesterol medication actually working mechanistically in my body? What is it doing? Right? No one's asking that. They assume that this is the solution and that there are no caveats or there's no secondary effects coming down the pipe. And there are, but us as personal trainers, it's hard to have those conversations with clients because it really is above our pay grade to be able to ship them to people like you who have that approach. I think is an important networking that the personal trainer community should have in order to get their clients to their goals.
Absolutely. And, I don't think it's above your pay grade at all to ask those questions though, right? Like, have you ever considered how this medication might be affecting your health?
That's a good way to put it.
And you have not told them anything, the answer to that, right? But you can at least get their wheels spinning to go, maybe I should know more about that. And who else can I talk to? And then that opens that conversation and that door to see who else is out there. I think one of the benefits of being a functional medicine practitioner is it falls under wellness, and wellness isn't restricted to state lines. So I see a lot of clients virtually, across the country. And so being able to be open, whether that's for child development, for a child who maybe a parent has a question about their milestones, or, they're not pooping, or I can't lose the weight. All of those can come to us under a wellness hat, which I guess is the blessing of the way the insurance model is set up.
All right, now here's for the hardest question. I wasn't planning on asking you this, but I have to now, because this is the question I ask almost everybody in the start of my interviews, and I didn't ask it with you, but I'm going to now at the end. Okay. I don't have an answer for this, by the way. I sort of waffle back and forth all the time on this. Should there be more or less oversight in the industry as far as giving advice like this? So giving nutrition advice, giving health advice. Do we need more certifications? Do we need less? Should it be the wild, wild west, sort of libertarian-esque, run your own business? Should it be all government oversight? Should we have one outstanding business? Does it function good as it is now? We don't need to touch it. What are your thoughts?
Well, it's definitely broken. I mean, let me start there, right? And I think there's so many reasons, right? We've tried to, for good intentions, control it, right? We've got government agencies in place to make sure that Joe isn't hanging out a shingle and giving people bad medical advice. And I appreciate that 100%. However, we've oversight controlled it to a point where people who have the experience and training are ahead of where we are in licensing. And, I feel like I fall into that boat, right? I've spent a ton of time studying this. I have advanced training in it, but there's not a license in functional medicine. So on the good side, I can see clients, I can treat them under a wellness perspective that opens me up to be able to help more people to achieve those goals. On the other side, it opens up the ability for anybody to do that, right? So you don't know what you're getting is good. And so I've had clients come to me and, and PT is regulated. I had them come under this as well. I had a bad experience already. I'm like, I get it, because not everybody has the same quality of training. Not everybody has the same understanding, and there's not a regulation to say you're practicing at a level that is good or not. So I don't know. I don't know what the answer is. I don't think that government oversight is necessarily the answer. And yet I appreciate why that's probably the best route we have in some perspectives. But I think it's broken and we need to do something to fix it.
Yeah, I'm with you. There doesn't seem to be one great answer, but whatever's going on currently also doesn't seem to be the right way. There needs to be some sort of fixes, and maybe the fix is that it's just going to take time. It's not that anything's going wrong. It's just that eventually the cream will rise to the top. There's a lot of good information being put out there, and hopefully the good information just beats out the bad. But there are, unfortunately, a lot of bad voices out there. There's a lot of bad information, and sometimes that bad information is simple and it's easy, and that's what people want to hear. Oh, all I have to do is this. All I have to do is this. When really, the answer is typically always more complicated than it's put out there to be.
Absolutely. Well, and I think the benefit, like you said, is there's so much information out there now. So you can really do your research. You can get out there, you can dive in, you can learn more about why a technique may or may not be appropriate. And I think that's, what the benefit of great podcasts like this are, is being able to come on and share information with more people, get the word out there that, yeah, the quick fix isn't usually the right fix. And you need to put in the work if you really want to see the results and the success long term and not create more problems. A pill for every ill certainly isn't the answer. And that includes wellness, right? There's not a pill for weight loss that's going to not give you problems down the line. But people want that quick fix. So learning as we go.
There are no solutions, only trade-offs. Jenny, this has been a fantastic podcast. Give my listeners not only some information about where they can find you specifically, let's say what you're doing for moms and for families, and then that's sort of the PT side, but also what you're doing in the functional medicine side. Is it a website? Is it an Instagram account, or anywhere they can reach out to you directly?
Yeah, absolutely. So we've got a website if you want to go and learn more about our practice, altogetherwellness.net. There's some free tools on there for moms, for kids, and also for the functional medicine side if you want to learn a little bit more about how maybe toxic and potentially problematic your health really is. We've got some tools on there to get you started, just to get you thinking. We do have an Instagram account, Altogether Wellness, and we actually just started a new one, Altogether Wellness Well Woman, separating out the kids stuff from the functional medicine stuff. So follow us on both of them, just to keep in the loop if both of those are interesting for you. But if one of those is more important than the other, then you can find us there as well. And we're on Facebook too.
My guest today has been Jenny Quartano. Thank you so much for joining the Trulyfit Podcast.
Thank you.